Hello, you're welcome. My name is Dr. Tope Olowogbayi. So today I want to be taking you through one of the core radiological tools that we use for evaluating a patient that wants to undergo Hifu, which is a non-invasive way of managing symptomatic uterine fibroids. Imagings are very essential for a patient that is about to undergo Hifu because it helps us to confirm the diagnosis of the condition, whether it is fibroid or adenomyosis, and it also helps us to confirm whether the treatment is successful or not, because we need to be able to use the post-treatment MRI to discuss with the patient in terms of the treatment that we've done. And then subsequently, we do a straight gauge scan to assess the reduction in the size of the fibroids after treatment, which is usually done at interval of 3 months. So after a patient has had consultation, the doctor will decide the type of MRI the patient is going to do, whether a pelvic MRI or abdominal pelvic MRI. So once the MRI is done, the MRI helps us to confirm the diagnosis and also the size of the fibroid, the location of the fibroid, the nature of the fibroid, be it iso-intense, hypo-intense, or hyper-intense fibroid, because we need all of this to be able to assess whether the patient is suitable for the Hifu treatment or not. So having looked at the MRI, we assess the suitability of the patient for treatment. So once we confirm this, the patient is scheduled for Hifu treatment. And after the Hifu treatment, we usually ask our patient to do a post-treatment MRI. And this is done between 72 hours to a week after the post-treatment. So what is the essence of the post-treatment MRI? It helps us to confirm that the treatment has been successful, because we focus on the contrast film after the Hifu treatment, where we're going to have a non-perfused area. That area is showing us that the blood supply of the fibroid has been taken out. So when you look at the images before the Hifu treatment, that's the contrast film, the fibroid will appear white, but after the Hifu treatment, it appears dark, meaning that that area, the blood supply has been taken out. And then subsequently, we monitor with a straight gauge scan. This image is the pre-treatment MRI that is showing us the T2, which is showing us the location of the fibroid. And this is the contrast film, which is showing us that there is blood flow to this fibroid, and that is where it appears white like this. In the case of post-treatment MRI, you're going to see the difference now. You can see that the blood supply to the fibroid has been compromised. What appeared completely white initially, you can see the dark area, which is an evidence that the blood supply to that area has been compromised. So this is where we refer to as the non-perfused volume of the fibroid. So because of this, the body begins to act on the dead fibroid tissue, and it begins to reduce in size. And we use scan to assess that reduction every 3 months for a period of 1 year. From this image, you can see that the fibroid tissue is still present, but the fibroid tissue is already dead after the Hifu treatment. The Hifu does not make the fibroid to disappear. We need to get this clear. It only reduces the size of the fibroid over a period of time.